10 Warning Signs of Calcium Deficiency. You can't ignore, plus 5 ways to boost calcium. Dear friends, sometimes the sharp pains, sudden fatigue, or unexpected muscle cramps you experience are not merely signs of aging. They could be the silent whispers from within, signaling that your body is deficient in calcium, a quiet yet critical mineral essential for overall health. Do you want to know why calcium is so vital? Calcium doesn't just build a strong skeletal framework. It also regulates muscle contractions, supports nerve transmission, stabilizes heart rhythm, maintains blood clotting functions, and bolsters the immune system. Thus, a calcium deficiency doesn't only affect bones, it impacts every system in the body. As we age past middle age, the body's ability to absorb calcium gradually declines. Decreasing levels of estrogen and testosterone after menopause and aging accelerate bone loss. Many people are unaware of their calcium deficiency until serious complications arise. That's why recognizing early warning signs is crucial for maintaining long-term health. Would you like to know the 10 earliest warning signs that your body is lacking calcium? Let's dive into each signal in detail right now. Sign 1. Recurrent muscle cramps, especially at night. Muscle cramps don't only occur during intense activity. When blood calcium levels drop, neuromuscular cells become abnormally sensitive, leading to uncontrollable muscle contractions and painful cramps. This often affects the calves, feet, or hands, particularly at night when the body is at rest. Research from the American Academy of Neurology shows that over 70% of calcium-deficient older adults experience prolonged cramps for weeks without a clear cause. Sign 2. Persistent bone and joint pain. If you feel dull, lingering pain in your spine, lower back, hips, or knees, it could be a warning of severe calcium deficiency. When calcium is lacking, bones sacrifice their own stores to maintain blood-ion balance, gradually reducing bone density, making bones brittle and causing aches, stiffness, or discomfort during movement or weather changes. According to the International Osteoporosis Foundation, 1/3 of people over 60 begin losing bone density unknowingly due to prolonged calcium deficiency. Sign 3. Weak, brittle, or easily broken nails. Nails reflect your body's calcium health. A deficiency weakens the keratin cells in nails, making them thin, brittle, prone to breaking, or developing horizontal cracks. Vertical ridges or slight indentations may also appear. Studies from the American Academy of Dermatology indicate that 60% of people with chronic calcium deficiency show signs of brittle nails, especially those over 50. Sign 4. Insomnia, restless sleep, or poor sleep. Quality. Calcium is directly involved in synthesizing melatonin, the hormone regulating sleep cycles. A deficiency can overstimulate the nervous system, causing difficulty falling asleep, restless sleep, frequent waking at night, and fatigue upon waking. Clinical research from Stanford University shows that prolonged calcium deficiency reduces sleep quality by up to 40% in older adults. Sign 5. Worsened premenstrual symptoms. For women, calcium deficiency exacerbates premenstrual symptoms such as abdominal pain, back pain, mood swings, irritability, and even severe uterine contractions. This stems from autonomic nervous system disruptions when calcium fails to regulate pelvic muscle contractions. Data from the American Endocrine Society shows that women with stable blood calcium levels experience 35% less severe menstrual pain compared to those with deficiencies. Sign 6. Tooth decay, weak teeth, or delayed teething in children. Calcium makes up over 90% of tooth enamel. A deficiency thins enamel, making teeth vulnerable to bacterial damage and causing cavities. In children, it slows the mineralization of primary teeth, delaying teething. Harvard University dental research found that calcium-deficient children have double the rate of cavities and up to 6 months delay in teething compared to those with adequate calcium. Sign 7. Silent osteoporosis. This is the most dangerous consequence of long-term calcium deficiency. Bones become porous, brittle, and prone to fractures from minor falls or impacts. Alarmingly, osteoporosis progresses silently for years before symptoms become evident. The WHO warns that half of women and 1/5 of men over 65 will experience fractures due to osteoporosis if calcium isn't supplemented in time. Sign 8. Weakened immunity and frequent minor illnesses. Calcium enhances immune cell function. A deficiency weakens immunity, leading to frequent colds, sore throats, respiratory infections, or chronic inflammatory conditions. A study in the European Journal of Immunology found that adequate calcium supplementation reduces the risk of recurrent colds by up to 30% in older adults. Sign 9. Brief dizziness. When standing up. Suddenly fleeting dizziness or lightheadedness, when standing after sitting for long periods, may be linked to temporary drops in blood calcium, slowing the autonomic nervous system's regulation of blood flow to the brain. Reports from the American Heart Association confirm that calcium deficiency directly affects blood pressure regulation during posture changes. Sign 10. Mild neurological disorders, numbness, tingling, or difficulty. Focusing. Calcium is critical for nerve signal transmission. A deficiency can overstimulate nerves, causing numbness, tingling, prickling sensations under the skin, or even reduced focus and mild cognitive decline. U.S. neurologists emphasize that chronic calcium deficiency can lead to mild memory impairment as early as age 50 if not addressed. Dear friends, by paying close attention to these subtle signs, we can hear our body's early cries for help. Illness doesn't always strike with intense pain. It often starts with mild numbness, recurring cramps, or brief dizziness. Listening early and preventing early is the best way to protect your health in old age, far surpassing any treatment. Dear friends, having explored the 10 clear signals your body quietly sends daily, like whispers warning of calcium deficiency, knowing them isn't enough. The real question is, what can we do to replenish calcium so our body no longer has to cry out? Would you like to learn how to restore calcium levels intelligently, safely, and effectively for the long term? Supplementing calcium is an art of biological balance, not just popping a few pills. Done wrong, the consequences can be worse than the deficiency itself. Let's dive into the 5 most scientific, natural, and sustainable strategies to help older adults absorb calcium optimally. Strategy 1. Supplement calcium through whole, natural foods, the foundation of any aging nutrition plan. No pill can replicate the perfect balance nature provides through whole foods. Over millions of years of evolution, the human body has been programmed to absorb minerals from natural food sources. Geriatric nutrition experts at Cambridge University have shown that calcium from natural foods is absorbed by bone cells 35% more effectively than synthetic supplements. Prioritize these calcium-rich natural foods: dairy products, fresh milk, fermented yogurt, low-fat cheese. Provide abundant, easily absorbed calcium thanks to lactose, which aids calcium transport across the gut. Small fish eaten with bones, sardines, herring, anchovies. Ideal organic calcium sources with a balanced calcium-phosphorus ratio. Dark green leafy vegetables, kale, spinach, amaranth, Malabar spinach. Rich in calcium, magnesium, and vitamin K to optimize bone absorption. Nuts and seeds, almonds, black sesame, chia seeds, soybeans. Valuable plant-based calcium sources paired with anti-inflammatory omega-3 fatty acids to protect joints. Bone broth, rich in type 2 collagen and trace minerals to strengthen bone matrix. Key takeaway: dietary diversity allows the digestive system to recognize and regulate calcium absorption based on your body's unique needs. Eating right, eating enough, and eating balanced is the sustainable key to a healthy skeletal system. Strategy 2. Optimize calcium absorption through sunlight and vitamin D. Did you know that without vitamin D, 80% of consumed calcium is excreted in stool? Vitamin D is the golden bridge that transports calcium from the gut to the blood and from the blood to the bones. Yet, over 60% of older adults in Asia suffer from chronic vitamin D deficiency due to limited sun exposure, aging skin's reduced synthesis, and diets low in vitamin D-rich foods. The simplest, most natural ways to produce enough vitamin D: expose your face, neck, and forearms to gentle morning sunlight before 9 a.m. or after 4 p.m. for at least 20 minutes daily. Include vitamin D-rich foods like salmon, tuna, herring, egg yolks, fresh mushrooms, and cod liver oil. If blood vitamin D levels fall below 30 nangwash ml, Experts often recommend 1,000–2,000 IU of vitamin D3 daily after blood tests and consultation with an endocrinologist. The harmonious synergy of calcium and vitamin D ensures minerals are deeply absorbed into strong bone tissue, preventing osteoporosis later. Strategy 3. Activate bones through regular physical activity. Remember, bones only stay strong when exercised daily through mechanical stress from physical activity. A 10-year Stanford University study showed that just 150 minutes of weekly exercise can reduce osteoporosis risk by 60% and maintain bone density into the 80s. Best activities for older adults: brisk walking for 30 to 45 minutes daily, Tai Chi to improve balance and reduce fall risk, gentle yoga to enhance flexibility and circulation, light resistance training with small weights to stimulate bone regeneration, swimming to boost circulation and reduce knee joint stress. Regular movement not only improves calcium absorption, but also enhances circulation, controls blood sugar and pressure, and reduces the risk of age-related cognitive decline. Strategy 4. Proactively control hidden factors that deplete calcium. Do you know the habits silently eroding your precious calcium stores? They include excess salt. Each extra gram of salt flushes 20–30 milligrams of calcium through urine. Excessive coffee, strong tea, or carbonated sodas. Increased calcium excretion via the kidneys. Refined sugar disrupts mineral balance. Smoking and alcohol weaken hormones that regulate calcium absorption. Chronic stress elevates cortisol, increasing calcium excretion. Adopting a healthy lifestyle and reducing these factors is the most sustainable way to preserve your body's calcium reserves, easing the burden on kidneys, heart, and blood vessels. Strategy 5. Smart use of calcium supplements for the right person at the right dose. Remember, calcium supplements aren't for everyone. They're only necessary for diagnosed osteoporosis, confirmed by bone density scans, prolonged malnutrition or poor diets, malabsorption or chronic digestive disorders, postmenopausal women at high risk of rapid bone loss. All supplementation must follow blood tests for calcium, vitamin D, and kidney function. WHO and American Endocrine Society guidelines state that total daily calcium from food plus supplements for older adults should not exceed 1–200 milligrams, paired with vitamin D3, K2, and magnesium to prevent vascular calcification. Blindly taking high doses long-term can lead to kidney stones, vascular calcification, and dangerous atherosclerosis. Treat calcium supplements as a controlled tool used only with medical guidance. Modern science emphasizes a surprising truth. The person with the strongest bones isn't the one taking the most calcium, but the one living the most scientific lifestyle. Dear friends, our bodies are adept at sending warning signals through aches, cramps, numbness, or dizziness. But it's up to you to decide whether to listen early and adjust in time or stay silent until complications arise. Smart calcium supplementation isn't complex as long as we have scientific knowledge, persistence, and faith in the body's natural ability to heal. Love your bones, knees, feet, teeth, and nerves starting today, even if clear symptoms haven't yet appeared. If you found this article helpful, please take a moment to leave a comment sharing your thoughts below. Your shares will help spread this valuable knowledge to more older adults in the community. And don't forget to subscribe to the Senior Health Vista channel to stay updated with in-depth, practical, science-based health content for your journey to sustainable wellness.